Oh, hi, everyone. A very good morning to all. I hope you can hear me. Uh, we'll just wait for 5 more minutes for others to join. I think we have quite a lot of numbers booked today. Hopefully, they all will be able to turn up, and then we can do the session properly, 40 minutes, and then uh, 20 minutes for Q&A. And there might be some questions which I don't have answer, but we can find people to give answers for us, if that makes sense. Good morning, Azhar. I can see. Nice to have you here. Morning. Morning, Jackie. Good morning, Angela. Good morning, Patterson. Good morning, Azhar. Good morning, Bibi. Quite a lot of familiar names here. Debbie Young. Good morning. Thank you for making yourself available to support. I hope you will find it useful. I've been spending last 2 days to prepare for this. So hopefully we will be able to get some nuggets out of it, and you can go back to your care homes and implement this. Jalteen Patel, Katie Wade. Yes. Hi, Katie. Kim, Kirsty, fantastic. There's quite a lot of amazing people here. Sally, Sandra, yes, all of them. Yes, personally, I know them. Zoe, Dr. Tom, thanks for coming in. So let's get started. So the winter plan was released last week. And then I decided, okay, why can't we actually go through it properly and discuss some, analyze some points with you guys. So let's close this. So what are you going to, I mean, for any training program, you really need to have an outcome out of this. So basically what I'm going to do is we are going to go through the adult social care plan, the winter plan, and go through all the steps step by step. But I don't think I'll be able to cover all of it, but we will cover the main points that's applicable for care homes. Unfortunately, I won't be covering any elements related to dorm care or supported living, but there are some aspects which are interrelated anyway. So, and at the end of the meeting, I will be telling you, I will be sending you an action plan as well. So you can tick off things that you are already doing and just complete it and put it in your folder saying that it's all done. So it's very important that next 6 months of our care home life is going to be, it's going to be really, really challenging. But I think now we know what we should be doing, and it should be a lot easier if we are really ready for it. So at the end of this training, I will actually send you an action plan along with some of the important documents that I have discovered while preparing for this, and I will share it with you so that it's very useful for you, and then you can share it with your team as well. So what is my background? Who am I? Who the hell am I? So I am a nurse by background, very passionate nurse. Nursing is my life. I love to care for people. And I'm also a manager of, ex-manager of a care home, which was rated as outstanding in all the areas of inspection ages ago, not ages ago, 3-4 years ago. And I'm also an author of the book, How to Get Outstanding. If you haven't come across the book, I encourage you to go and buy the book, and don't just read just before you go to sleep. Read it while you are working and go through it, put action plan in place and improve your care home so that you can deliver amazing care for the people you look after. So that's the purpose of the book. If you haven't bought it, it's available in Amazon. You can check the reviews. If you're still not convinced, come back to me, no questions asked, I will refund you the money. So that's the book. And I'm also a keen researcher, so I love to read a lot of things. And uh, any updates about COVID, I'm constantly up to date myself. I spend about 2-3 hours a week in order just to research, going through the 400 emails or average 400 emails coming through every week. So just to keep me updated. And now I work as a consultant. I help care homes to go through this kind of crisis. Nobody expected this, but I had to adapt as well. So in order to help care homes, I have to keep myself updated. Hence I can support other care homes. So I did support few care homes during the first wave of COVID, and they didn't have any cases. It may be purely luck, or it may be due to the action plans that they have implemented because of me. So nobody knows, but I think they did really enjoy the journey during that time. So it's all about working together collaboratively, and you got somebody there to support you when there is a need. So that's a bit about my background. So I'm sure uh, you must have already read this winter plan already. Uh, if you haven't got time, I encourage you to sit and read through it. And there's nothing new in it. So we have an advantage of this advantage over the first wave. Yeah, or the second, this is happening second time, and the cases are going up, and it's not going to be massive. Cases are going up, and we already know now. We have an established plan of what we should be doing. So we know about how to use PPE, what kind of PPE should be used. We know about the visiting policy. We know about the risk, what type of risk are possible causes of COVID in your care home, and who can get affected, and what type of risk you should be doing in terms of your staffing, and also about the contingency plans as well in terms of your staffing numbers, your financials, your PPE stock, and the communication plans, and how you handle the relatives and family as well. So we already know what we should be doing for the second wave anyway, and now they have put everything in the right direction. It's a policy document. Policy means it gives an overarching view of what should be happening nationally, at a local level, and at the provider level. The beauty about this document is it clearly explains uh, what each department should be doing. And I think I love it, because I think some of the policy documents in the past didn't have this kind of things. So it clearly explains what the CCG should be doing, what the NHS should be doing, what the national ministerial department should be doing, and what the provider should be doing. So we will be definitely only focusing on what providers should be doing in the seminar, because I don't think I'll get time to go through all of it, but the providers, that's what we should be doing. And we create an action plan in order to do that. So I think the context is, so if we reflect back, I think death rates due to COVID is more common in elderly. 9 out of 10 people died are people older than 65. So that's a big number. And 1 in 4 had dementia. 2 in 5 was from a care home. So there are, I think it's around 15,000 people died because of COVID from care home. So it's a very big learning curve for us. So we must speak to the care homes who are already gone through this, and try to learn from them if possible. First time, we may be lucky. We didn't have any coronavirus cases in our care home. That's good. It may be due to your proactive measures, or it can be due to pure luck, because it's very highly likely that this can get into your care home very, very easily. So if you, even if you had COVID, it doesn't mean that it's because of your fault, or it's because you haven't acted properly. It may not be that. It can happen even if after you put all the strict measures in place. So don't get disheartened with it, and don't be worried about what's going to happen next time. This time you will be more prepared, and you know what to do than anybody else, which is an advantage for you. And so, now, I think although the system is not still perfect, I think there are concerns around testing, there are concerns around flu vaccine distribution, there are concerns about isolation facilities not applicable. So there's quite still a lot of concerns around what's going to happen. But at least we have an established system now. The staff knows what to do, the managers know what to do. CQC is learning what to do. I'm sure they are also evolving through this crisis. So what is the wider perspective? I think normally in England and Wales, 23,000 people died during the winter. I think that is the stats for 2018 and 19. Uh, in 2018-19 winter, it was relatively low in comparison to other times. So usually the care home deaths spike from December onwards. That's the usual pattern. It's because the leading cause of death is respiratory disease, especially pneumonia. And I think, so I was actually looking for, I was actually looking to find out if there is any relationship between flu and COVID coming together. So I could find only one study across the internet. Maybe my internet skills is not good, but I tried to research and I found that from the one of the study that is done by PHE between the data from Jan till April this year, the people who had COVID and flu were highly likely to die, like 5.2 times they were likely to die. So it's a combination. And I also saw in some other research, it's saying that you can't have two viruses because it compete with each other. So it's really conflicting. And again, it's an uncertainty for us. But the good thing is we have vaccination for flu anyway, which is good. So it's better to get it done as quickly as possible. I know there are difficulties in accessing it already. So it's like going to be probably like PPE. We had shortages in the past. In the same manner, there might be shortages in the flu vaccine as well. If you can get hold of it as quickly as possible, that's good for you and your residents. And it's interesting that there are significant rise in cases in Europe and US. So countries like Germany, France, Italy, Spain, the cases are really going up, and that pattern is going to reflect in England as well. So it's very important that you get ready for it. The second wave is happening. We are more prepared, which is good, but the risk remains very, very high. And another issue would be a significant number of care homes are not purpose-built, and they are without any on-suite facilities. And that's going to be really a big problem going forward. So I think from now till end of April, I think after the winter, we should be able to know what is going to happen to the care home sector, because a number of proportion of the care homes are less than 30 bedded, and they are not purpose built as well. There is limited facilities to do infection prevention control measures. So how the care home sector is going to evolve after will be more clear after this winter. And we are entering into the toughest phase of the care that we have seen. I think your leadership and your robust preparation will decide your care home's future. Let me repeat that. I think your leadership and your preparation will decide your care home's future, whether it's small or a big, or you're a corporate provider, whatever it is. I think the local leadership and your preparation, how you follow the protocols, that's going to decide your future. So it's very important that we get ready for this. I just want to make sure that I don't run out of time. So I think the first aspect, as I said, the guidelines actually focuses on few aspects. So what needs to be done at the national level, what needs to be done at a local authority level, and what needs to be done at the provider level. So we are going to follow only what is required by what the provider should be doing. So I think now we have a PPE guideline, safely working care homes. The title is changed, but follow word by word guideline. It's very, very important. I think follow table 1, 2, and 3 as it is. So during this time, I managed to do some inspections for some care homes, and it is very important that and what is in the guideline and what was reflecting on the floor was so different. They had very robust contingency plan, very robust risk assessment in place, but the practice was so different, and that's where we are going to lose. So it's very important that if during the day and the nighttime people follow those guidelines. That's very, very important, I think. So table 1 is when you are doing personal contact, that's within 2 meters, you're doing personal contact. So you need to wear gloves, mask, and aprons. And visors is to protect you. So the purpose of the visor is actually to protect this droplets coming into your eye, that membrane, and you get the infection. So it's to protect you. So it's a good practice. If you are worried, you wear this goggles if you want. That's a good practice when you are actually going to a risky resident. And table 2 is when you are within 2 meters but not touching or personal care, doing personal care. So in that case, you are just wearing the mask. And table 3, anywhere within the building, I think, did I get it wrong? Yeah, I think table 3 is anywhere within the building you have to wear a mask. So if you're working in the kitchen, if you're working in the laundry, if you're working as an administrator, you should still wear the mask. So what type of mask you should be wearing? So one of the things that you should understand is the difference between the type of mask being supplied to you. So type 1 is 95% filtration. Type 2 and 2R is 98% filtration. And then you have FFP2 and FFP3. FFP3 is used only for aerosol generating procedures such as suctioning in nursing homes. Usually residential care homes doesn't have to use FFP3. Type 2 and 2R, the difference is one is a fluid resistant and other is not. You should go back and check your mask, what exactly it is. If it doesn't says EN14683 2019, that's not type 2R. So you might be getting that cheaper type 1 and type 2, but that's not the one you should be using. So when you're doing personal care, the purpose is to use type 2R because the staff is not actually spreading that infection droplet to your resident. So it's to protect the patient rather than the wearer. And FFP3 is more about to protect the staff rather than the patient. So you need to understand the difference of why we are using what we are using. So I think if you go and check your mask, make sure that you follow the rules, the EN14683 2019. So I'll go through the chat and the questions later on. Otherwise, I wouldn't finish this if that's okay. So it's very important that you do a refresher training before the winter. So get your staff on board, uh, have a meeting, go through the IPC refresher training, do donning and doffing. What you don't want is CQC coming in and observing bad practice. So one of them being non-compliant is going to affect your care home very much. So the more effort you put for training, that will reflect on the practice, and hence you will have less problems with COVID. Infection control audit. Okay, so many care homes tend to do a detailed IPC audit once in 6 months or once in 4 months. That was a usual practice. You know, the long document, we get it from PHE, Public Health England. That was a usual practice. But I think things have changed now. Audits are done in different ways. So you can do long-term audits, you can do short-term audits. So when you find a small problem, you do a short-term audits to make sure that it doesn't get slipped. So you do that for 1 or 2 months or 3 months to make sure that the new change is actually embedded in that. So if that's not the case, if that's the case, you can stop that audit. But in terms of infection control audit, I think this is a high time that you do a practice audit. It's very important. I think it's more about observation and practice, how you are observing the practice. That's very important. I think you can't really miss that. And you want to make sure that the staff are following the PPE guidelines. They're washing their hands when they go from one resident to resident, use alcohol gel or wash their hands. Nails are clipped, changing the uniforms, how they wash the uniforms. There's quite a lot, simple basic things, but it's very important. I think you need to really monitor that. And the care home owners and managers and other professionals, nobody is exempt from any of this infection control practice. So that's very important. When I did some mock inspections during this time, what happened was uh, the owners may be a bit reluctant to wear the mask. I'm not saying that every owner is like that, but I'm just telling that everybody, despite the job role or despite the authority, everyone should follow the same guidelines. You have to lead by example. That's very, very important. And yesterday I was actually reading news about one MP not wearing the mask while traveling in tube. So uh, that's not what we want. What we want is leadership by showing example. And again, having an IPC champion is very important. And it's not just for the sake of having an IPC champion, it's more about the aspiration, the inspiration of that person to deliver high quality care. So it's very important that person is really motivated to monitor what's going on in your care home. So if that's not the case, then that person is not suitable to be IPC champion. I know in terms of CQC inspections, we like to show off champions, which is very good, but not just the paper or certificate. What we really want is how effective they are in auditing and monitoring what other people are doing, and in terms of IPC. That's very, very important. And staff reporting any symptoms, uh, ask them not to come in unless tested. You can facilitate those. Say example, if staff is not coming in because one of their household member is having fever, going forward, the testing is going to be really difficult. We're starting to see that already now. So you might want to have some kind of facilities to test it urgently if needed. So there are private testing companies available out there. I think it costs between 140 and 150. So in case if you want to admit a new resident, that may be something that you want to consider. If they are coming from home, you want to get them tested. So in terms of if it's a staff showing symptoms, you may want to get that. So it's all about being proactive and finding other ways in order to get people tested and move your operations smoothly. So don't always focus on calling for help from local authorities, CCG. Yes, that's all very helpful, and they are helpful too, but sometimes it's beyond their control. So in that case, you have to take your own steps, measures in order to move your operations right in the right direction. Stock management. Okay, so I also want to tell you about the testing. So now NHS has got a new app, NHS Trace and Test and Trace app, which indicate the risk. So I think one of the purpose of the app might be, I'm not sure, but it might reveal who is in contact with who. So in the long run, you may want to make sure that the staff really keep social distancing within the building as well, which is very important. And I am really surprised when I see social media photos and videos showing that staff are sitting close together or with the resident, uh, when the guideline is actually to keep social distancing measures wherever you are in the building. So I think all this kind of photographs and evidence can lead to legal issues in future. So make sure that what you post in social media is you should be very careful, and at the same time you should be keeping social distancing measures to protect your residents and the staff. So if somebody is not wearing PPE and they are together and one of the staff is tested positive, all of a sudden all of your staff will have to isolate, and leaving you with no staff to look after your residents. This has happened in so many other scenarios before. So please be aware of those kind of risks. Stock management. So you must be very thrilled to have to hear that free PPE is coming from the government, which is great. I think we are more prepared than before. So now the supply is more. I am personally engaged with carehomeshopping.com, so I understand what is the level of PPE available in England at the moment. So there is no shortage of PPEs. With regards to gloves, I think the production is not meeting the demand for the old world. Most of the gloves production is coming from East Asia, China, Thailand, and places like one of the African countries. So gloves are coming from these places, but still the production is not meeting the global demand. So the prices are definitely going to go up. So what you really want to do is you really want to stock the PPE for next 3 to 6 months. Even though the government is going to provide it, it may be like testing service. It's a complex thing to support 16,000 care homes across UK. We can't really blame anyone. The system may fail at some point. So it's very important that you stock and keep reserves. And I think one of the guidelines, the guideline says, if you have a shortage of PPE and if you can't take care of the people admitted to your care home, then you will have to report that to local authority. So I think reporting so many times that you don't have PPE, enough PPE, that might trigger a potential CQC inspection as well, because that's actually creating a red flag on your care home. So it's again being proactive on what you can do so that you are not flagged as a high risk care home, which is very important. Yeah, I think it's very important that you should keep your stock. And again, use of mask and aprons, don't be very conservative. So I have come across practices such as people are being allowed mask to wear only one in a day, or that's not fair. That's not fair on the staff working for you. It's very important that you change it very often, or when you're taking out for meal, don't reuse it. So those sort of practices can really affect your infection control precautionary measures and affect you in the long run as well. And when these evidences are repeated, so for example, if you have a bad COVID situation, there might be a public inquiry into the incident, and then in those sort of inquiries, all these issues will come up, which may bite you back going backwards. So forwards, it's very important. And I'm also delighted to tell you that about carehomeshopping.com. I co-founded it, and there's quite a lot of good deals in there. If you haven't seen the website yet, please go to there. Don't just rely on your traditional suppliers. Just encourage small enterprises such as ours as startups for us to survive. Just buy something from there as well. It's a good deal. It's like an Amazon for social care sector. So many sellers are selling, and we are actually checking all the items that's listed over there. So it's called carehomeshopping.com. Don't forget it to check. So flu vaccine. Flu vaccine, yes, it's free for people working in care homes, although the availability is questionable at the moment. I think you may want to develop a good relationship with your pharmacy and GP to make sure that you get your flu vaccine as quickly as possible when it's arrived. So you should be first on the list. So you should be actually calling them and saying, as soon as we have this, can we have it? So be proactive and don't stay silent with your GP because it might run out. So the amount of uptake for flu vaccine is going to be very, very high. And flu vaccines are more effective when taken well before the winter. So it needs at least 2 weeks to kick in to trigger your antibody mechanism, and it can last up to 6 months. Sorry, I have missed. Flu vaccine. Okay, so it can last up to 6 months. So basically, flu vaccine is a guess game. That means we don't know what strain of virus is going to appear during this winter, but they make it based on the assumptions. So I genuinely hope this time they get it right. I think a couple of years back, the flu vaccine effectiveness was not good enough, and hence we had quite a lot of people with problems. So make sure that you get access to flu vaccines as quickly as possible. And also the guideline also says that you have to report this data through the capacity tracker or skills for care national minimum data set. So it's very important that I think that's going to be updated in capacity tracker. So somebody is having access to your care home data at the moment. So make sure that you follow the uptake or increase the uptake of your flu vaccine in your care home. That's very, very important. Sometimes you may have to incentivize your staff to take flu vaccine or tell them really, this is very, very important. You have to follow this. And anybody who is at high risk within your staff team or the residents are usually easy. They usually be compliant with taking flu vaccines, but not all the staff. But this time they may have to think differently, and that's where your leadership should kick in and tell them you must take it. So it's very important. We can't take any chances with this. I think there was one study, as I said, 5.2 times death rate if you have flu and COVID together. So we don't want to take any chance. So make sure you get access to it as quickly as possible. You can even buy flu vaccine privately. That cost, I think last year or the year before, I bought it for 5 or 6 quid. So I don't know what's the price now. So anything the increase in demand, the prices are going to go up as well. So just look at your options. Very important. So testing and tracing. I think there are still problems with the implementation of testing and tracing. So we sometimes we take the test and we don't get people to come and collect from our care home. So in such cases, you may have to do that again at nighttime, and then they will come early in the morning. So you have to have different versions of how to implement it. And going forward, the demand for the test is going to go high and high. If you have spare test, keep it safe. You don't have to waste it. So keep it safe for the people who are having symptoms. Again, everything is based on, I think government is actually advising us to do whole home testing. So we are supposed to follow that. But going forward, if there is a limitation in the testing, then you can do a risk assessment and say, okay, we don't have the number of testing available enough. So hence we do only for the people who are having symptoms. That's only a possibility, but just keep in mind, you can adapt according to what is happening in next couple of months. Testing is very important. I think more important is being proactive in identifying the first case. So identifying the first case is not the responsibility of just the manager, but even the staff who just do the two night shift in your care home. So no one should miss to report any changes in clinical unwellness. It's very, very important. So even if it's at nighttime or Sundays or weekends, if somebody finds that somebody has got a fever or a cough or breathlessness, it has to be picked up as quickly as possible. The success for doing this or preventing COVID in your care home is finding the first case. I think the earlier you find it, you stop that at that level, and then you continue the cycle for 28 days, get yourself free from out of it. And then the cycle continues. I think if you do that for next couple of months, that should be keeping your care home safe. So don't miss it. I think everybody should learn what are the symptoms and what we need to look out for if there are any changes of in our resident status. Same with the staff as well. Don't let anybody to come in if they have fever or any kind of cold, cough, etc. Elderly population, it is highly unlikely that they may develop a fever. So they don't have the immune functions to trigger a fever in their assist, especially for people very, very old, more than 90 years old. In that case, you need to pick up the soft signs of being unwell. If, for example, I think one of the practice that I came to my attention was people have regular paracetamol, 4 times daily. And then they give it 8 o'clock, and then they go and check the routine temperature checks at 10 o'clock. So even if you have fever, you miss to pick that. So it's very important that you be very clever enough to check those temperatures during the start of the shift rather than after giving paracetamol or any NSAIDs, which could bring the temperature down. And I think if one of your staff is identified as positive, the first question will be where they're wearing mask with when spending time with other staff. So if the staff have breaks in a crowded place without any PPEs, if someone reveals that, then they all have to go into isolation. So interesting is the government has actually announced 500 pounds for people who is going for isolation. So this is going to create a little bit of chaos, I am imagining. So some people may want to take benefit out of it. So sit at home, they get 500 pounds. What a great thing to do. But majority of the people will not be doing this, but you may want to be very careful about this thing. So because it's paid, you may want to give little attention so that it's not being abused by someone who is not good enough. So breach of PP is very important. So staff risk assessment. Yep. First of all, you need to have a spreadsheet, okay, of the risk factors. So you can say name A, B, and C, and the risk factors are what is their age, whether they are from BAME community or they have any underlying health conditions. So that's the top part. And then you tick down who is coming at high risk. And then when you have identified somebody who is having at high risk, then immediately you need to develop an individual plan for them. So that plan should actually go to their own individual folders, not in a generic folder, which is accessible by everybody. I think anybody who has got health data, it has to be strictly confidential and it has to be kept in a place where it's locked. I think anybody who has got medium to high risk staff, do a detailed plan. If someone has, any of your staff has type 2 diabetes, if they're on insulin, then I wouldn't actually recommend them to come in to your care home to work if you have COVID in your care home, because that is a way risk for them. So I come across a case where one of the staff was from a BAME community, and he was a young man in his 40s, and he was type 2 diabetes, taking insulin, and he was affected with COVID, stayed in ventilator for 60 days, and he passed away. So it's very important that anybody has got type 2 diabetes, anything to do with increased blood clots, heart conditions, so you take extra care of those stuff. So in that case, you have to adapt to them. So that person might be able to do care planning. If you have COVID, in your care home, they can do care planning, or maybe work in a different department where they're COVID free and they don't have to attend to that particular COVID patient. So be very, very careful, because the last thing that you want is losing one of your resident or the staff. It will be really upsetting and demotivating for all of us. And there was a social care task force. They recommended regulation around not allowing the movement of staff between care homes. So it's not implemented yet, but that's going to be coming very soon. So anybody who is using agency quite a lot, I think I would recommend you to forecast your staffing and do recruitment as quickly as possible. So many people are unemployed, and it's going to be the case going forward as well. So recruiting staff and training and upskilling them wouldn't be a problem. I'm not saying that everywhere it's the same, but there are areas where recruitment is really a big issue. But you have no choice. Either survive through this pandemic. We don't have choice. We don't have to look back. If we have shortage of staff, recruit more people, get it done. So that's very, very important. And it's always better to have surplus staff than not having enough. So the reason why I say that, the occupancy might go down in care homes. So it came down to like 80% nationally after the first wave. So when you don't have enough staff, you tend to protect yourself saying that, oh, I don't have enough staff and hence we can't admit any new people. That's a very bad strategy. So you have to think in the reverse way, where you have more staff and you can accommodate more people and you can take care of people if they become unwell as well. So keep your occupancy as high as possible, and any inquiries that's coming through, it's gold dust, and you have to really proactive in following up with them and make sure that those people will come to your care home. That's very, very important. Staff, we already know that how much difficult it is to cover for December and Jan. So if you haven't put the Christmas rota already, it's better to do it now. If you have put the Christmas rota already, you are in a very good position. Congratulations, fantastic. If not, if you're dreading to put that rota, or you're not sure or how I'm going to do that, that means you are not in a safe position. You may want to review it as quickly as possible and put the Christmas rota. So create a staffing forecasting model. So I'm sure you are already aware of these things. You need to calculate how many hours you need each week in order to keep your care home going. And based on that, you look at your existing staff availability hours and you match it. And if it's high, that's well and good. If it's very, very low, start recruiting. So you need to calculate the staffing forecasting for next couple of months, probably Jan until Jan. And staff training is very, very important. COVID training, donning and doffing competency, and IPC competency as well. So residence risk assessment, it's very similar to staff. So again, it's based on age, diabetes, health conditions, risk of stroke, high blood glucose level. These are the things that will trigger COVID becoming worse. So you can have mild symptoms, get better in 2 to 3 weeks, or you can have moderate symptoms. It will take up to 4 to 6, 8 weeks, or you can go to real ARDS and get ventilated, and it takes a long time for you to recover, for your residents to recover, especially if they are old and have some underlying conditions. So what should we do in terms of care planning? So I think if I'm doing a mock inspection for you, what I want to really see is, so if somebody is classed as high risk or they are under clinically vulnerable position, then you really want to write a care plan stating, it's not generic COVID care plan, I don't like it. What you have to write is, okay, this person has got this A, B, C, and disease condition, and this is what we are doing, and this is how we are protecting them. And it has to be really personalized. And if they develop COVID, and you have to keep on updating every 2 weeks, saying that, oh, this is how they are progressing. So it's not about just one policy making thing for all the residents. It has to be individualized and personalized. And that's what CQC will look for as well. So when somebody has got COVID, how are you keeping their care plans up to date? So it's very important. And if they're asymptomatic, if you don't have COVID in your care home, very good. So in that case, you need to check temperature, pulse, respiration, and saturation as well. You have to use Restore 2 or News 2 scoring if deterioration is evident. So that's especially for residential care homes who doesn't have clinical skills to pick up all these things. If you're nursing, I'm assuming that your nurses will pick up those kind of soft signs of deterioration anyway. So if somebody is symptomatic, then you have to check the temperature and vitals 4 times a day. And ideally, you want their own machines as well. So you don't want to share those blood pressure machine and saturation probe to everywhere. So have plenty in stock if you can, because the availability of those machines have increased now, which is good. But going forwards, that might come low again. So I'm fine. Are you finding this useful? I'm sure this is something that you have done, and I'm just reiterating, going through the points. So I'm sure you're all with me here. Are you? It's very strange to do webinar. Yes, thank you. Yeah, fantastic. Okay, great. Thank you. Fantastic. Okay, great. Let's move on. So planning, okay. So admissions. I think delivering care in their own home seems to be what government is encouraging for better outcomes. So the government strategy will always be uh, put people in their own home. I think that's good for them as well. Who wants to go to a care home? Who wants to go and admitted in a care home? You know, I would like to stay in my home all the time. Uh, so that's the government strategy. But questionable is in case of COVID, I strongly believe that most of the residential care homes are not skilled enough to undertake huge task of looking after someone with COVID. So clinical skills is missing in our residential care homes, but that's something that you can train them. So get a very good nurse to come to your care home, train your staff on those things. I think I'm sure your local CCG uh, your CCG will be able to support you with that. It's all about practice. It's not about policy and guidelines, risk assessment, and putting in the folder, job done. No, it's more about what your staff is doing in the communal areas, what your staff is doing in the rooms, how are they following the practice, can they actually have got the skills to pick up if somebody is unwell, if somebody is not eating, if their bowels are not opening. So that's a skill that we need to upskill for all our carers as well. So going forward, residential care homes needs more clinical training. I mean, which is already undertaking in many several places. So a point to note is, even though the admissions to care home document says the government makes it very clear that this is only a general guideline, and it's up to the provider to follow the Health and Safety at Work Act of 1974. So it's very important that you have the ultimate responsibility of keeping people safe. So if somebody comes to your care home, it's your responsibility. If you're actually transferring somebody, it's all, at the end of the day, each care homes are independent business, and you are liable for your actions. So any decisions that you make, you can actually put that fault on anybody else. So it's very important that if you make any decisions, that should be justifiable for you yourself, for the person who is owning, or a person who is making the decisions. So I think one of the things that I advise my care homes during the COVID first wave was have a spreadsheet of the decisions that you're making. So when you go forward, you won't be able to remember what happened in November or December 2020. So have a spreadsheet saying, okay, decision to be taken, who made the decision, why you made the decision. Sometimes it might be compromise in something, but as long as you keep the safety as a priority, that's fine. But make sure that you involve people in your decision making and keep a note of it, and maybe let your CQC inspector know as well about it. That's very important. Alert local authority when positive cases are transferred to your care home. I think that's something that we haven't seen before. So you have to alert your local authority, and local authority, you also have to alert local authority if not accepting any confirmed COVID cases. You also have to tell them staffing facilities, why is it that you are not admitting people with COVID, or what is the reason for your non-admission. So it's very important that you let them know. But there is a tricky part in there, is that when you actually say that you can't take admissions or because of so and so reason, that those reasons shouldn't actually trigger you as a high risk care home. So be very careful about what you communicate with stakeholders. They're all very supportive, there's no question about it. But you may want to solve your problems within your care home first before it's being spread to others. Uh, yeah, no, I am talking in terms of as a consultant for care homes to support you, rather than, overall picture, yes, of course, you have to be transparent, open, and honest with other people. And update capacity tracker as well, because in order to claim IPC fund, they made it very sure that they made it clear that you have to update the capacity tracker, which is some kind of data collection for the government, which is good. I really feel that we should do that. There has to be some kind of centralized system. I feel that going forward, CQC inspectors may want to access your care planning going forward. And the only problem with that is, I'll tell you that later. So technology and digital support. So is there any benefit in going more digital? Yes, definitely there is. And there will be a new data security and protection toolkit specifically designed for care sector. There's already one in NHS website. You can download that, and I think care homes come under category 3. You download that spreadsheet and just delete all the rest. I can send you the link as well. But make sure that you, if you haven't done the data breach or GDPR audit in your care home yet, which is very common when I go around. If you haven't done it yet, yes, please do it and go through it, because it is a requirement under the registration. So NHS emails, and there is some offer from NHSX for offering tablets for communication, enhancing the communication between care homes and GP. So you can contact digital social care for if you can get hold of a iPad or whatever computer they are providing free of charge. And I think on a wider perspective, if you're already not using a digital care planning solution, I think this is a time to start exploring. The only problem is you have to be mindful about the implementation. So if you're looking to implement a care planning platform at this stage, yeah, I think if your paperwork is very good, stick on to that for now, and you wait until April in order to implement that. When you implement any new system, you have to be very cautious about what is ahead of us. So I think second wave of COVID is coming up, and if you're also expecting another CQC inspection, I wouldn't actually recommend you to go digital straight away. I think I'll wait for those things to happen and then implement digitalization. So I think going forward, CQC inspectors will ask your access to the care planning. I think I think long time before, when it was all paper, we were so lucky that we can give the best care plans and show them, and they will be happy with that if you're lucky. I think now systems are changed. They can access all the care plans, and they can look at all your care plans and see where you are actually missing. I think care planning softwares are brilliant because you can really see the entire care home operations in that particular thing. So if you give me access to your care planning platform here, I can review all the care plans and say how good you are as a care home. So the amount of data in it is very, very important. Lack of data is also showing that there's no proper care in your care home, which is not the case. I think you are all doing great anyway. So visiting, that's a very controversial topic. I don't want to touch too much on it. So I think before developing a visitation policy, I think you have to consider a few things. One, if the staff is taking a test outside of your care home, and if they come back positive, then you have to review your visiting policy. And then it is also based on the local intelligence and readiness of the care home to respond to positive cases. So, and your local authority, director of public health, should be sending you a letter stating, okay, what is the status and can you enable visiting in your care home? So be very cautious. It's a very sensitive area because people want to visit their relatives, and we don't have the right to restrict them as well. There's a lawsuit going on at the moment. So you want to involve your residents and relatives in your decision making. Don't just say the blanket rule of no visiting allowed or anything like that. No. I think it's all based on risk assessment. I think consider also the health and well-being as well. Adapt it based on the categories of the resident. So for example, if you have a resident who is looked after by husband or wife who comes to your care home every day to help them with meals, help them change their clothes, in that case, you have to adapt your visiting policy based on that. So you may want to instruct that particular visitor saying, okay, what is your scenario? Are you doing the shopping, or you may want to explore a bit more on what their circumstances are, and then you may want to enable them to come along if they are also tested weekly, or some kind of arrangements if you can make. So it's very important that no blanket rules. It has to be resident specific and category specific, and how you can encourage the health and well-being of the resident as well. And consideration to MCA, FBI, and DOLS, that's very, very important. If you're making a decision for somebody not to have visitors without involving anyone, that's a very legal that's a legal complication. I think CQC can come in, pick it up, and they can give you a request improvement on Regulation 11. And supervision of visitation is very, very important. I think I've recently been to a care home where they support this, visiting, and and the policy clearly says no cup of tea needs to be served, and they have to keep 2 meter distance, and they have to be sitting opposite to the tables. This thing was not really happening when I visited, and it's all about practice and how you observe it. So it's all good in paperwork, well designed, but I think the COVID is more about how you practice what you preach. End of life care, definitely the visitation should be allowed in the best possible way. Again, a definite risk assessment needs to be carried out in that case. Provide proper PPE as well, and teach them as well. Sometimes some of your relatives, you may be able to train them on IPC, and you can adapt a little bit in order to encourage them to come and visit and support you as well. And these people know your care home very well, so they could actually engage with you if there are no other risk involved. So look at the potential opportunities, how you can make use of them as well. But the main thing is no blanket rules. Don't just send a blanket rule saying, okay, we are going to stop visiting. That's going to come back and bite you. So it's very important. Preparing for CQC, this is my favorite one. So CQC, they were actually in a state of, they were frozen at the start of pandemic. I think they are now getting a grip of what they need to be doing. I think CQC itself is evolving their style of inspection, and they are focusing currently on high-risk care homes, targeted inspection on safety and well-led at the moment. So if we have issues of safety and well-led, or if you're rated inadequate or requires improvement, or there are considerable number of safeguarding or number of safety injuries, it's highly likely that they turn up to your care home. Just probably they will ring you at 6 p.m. To say that they will be there next day, so that you won't get enough time to prepare. I wouldn't say you have to prepare either, because you should be prepared for CQC anytime anyway. Anyone who operates a care home in England should follow the regulations. So all the time you should meet it anyway. So if you haven't seen the audit tool, go to carehomeshopping.com. I think you have seen the CQC framework for IPC, which I have actually developed into a Word format. So you can actually go and download this audit tool from carehomeshopping.com. You just Google audit, CQC audit tool, just download it and put your evidences against it. So anything that you have done, saying, okay, visiting policy, this is what we have done. So put the examples in there so that you can send it to CQC and you are ready for inspection anytime. They also want to see your business contingency plans, staff resident risk assessment, and your COVID tracker, meaning, okay, who was positive, when was it positive, and when is the isolation ending. You can have all those things in a spreadsheet. And PPE stock monitoring is very, very important. I think although the government offered you free PPEs, I would be very cautious. If I am a care homeowner, I would buy and keep it in stock without telling my staff that I have stock. So you can store it anywhere. Don't forget, buy from carehomeshopping.com. I love promoting that, don't I? So guidelines and implications is very, very important. So government is actually sending out guidelines every week. So different things are coming out from different departments. So it's very important that you keep up to date with it. It's not about keeping up to date. It's about what you are doing about it. So read the guideline, make an action plan, and go through it, tick, tick, tick. So if you have done that, you are in a safe zone. So visiting policy, and I think you also need to give it in alternative community communicating formats. So big letters, big, or in different formats, to make sure that everybody's needs is catered for. And practice observation. So uh, basically everything is good in paper, and if it's not what's happening on the paper, if it's not what's happening on the floor, then you are in a big trouble. So I am a keen believer in observing the practice and making it right, and going and telling the staff, saying that's not how it should be done, it should be done in this way. So hand washing, I think there's a little machine which encourages people to wash hands for 20 seconds. I think it's we are going to sell that in care home shopping. So there are quite a lot of useful technologies out there which can help you during this time. But be very careful about what you purchase. Some of the items are not very useful in my opinion. So be very careful about what we invest in. I think practice observation and trade-off implications. So basically CQC wants to see whether you are actually following the CQC framework for a IPC. So I think if you audit against that, you should be covered. You should be covered. But again, inspections can be triggered by what state you are in. So if you are requires improvement or inadequate, or there are safeguarding issues and change of manager several times, this can all trigger your inspections. And they I know few care homes who's been on who had big problems during this time. uh, so I think judicial reviews and everything is happening still. So you have to be very careful. I think don't consider CQC as a you know you know security guard, or in a bad way. I think they are doing the right job. I think if we follow the framework, that will keep our residents safe and our staff safe, and our care home is following the regulations, so there's no problem. So managing finance, I think care home businesses never seen such a degree of financial pressures before. Oh, yeah. I mean, you may argue with that. It depends on what your situation is. So if you haven't come across coronavirus business interruption loan, please go and check it out. So it has been extended by Rishi Sunak yesterday. You may need to speak to your accountant about if you are intending to apply for coronavirus business interruption loan. You may want to have your accounts ready to apply for it. You can actually invest that money for probably extending, or maybe making a room nice and clean and tidy so that you can admit more people, generate more income. So you can use it in different ways, or use that money to create a buffer for going through this pandemic. It all depends on what your intentions and motivations are, but always speak to your accountant. I am not a chartered accountant. It's very important. There's quite a lot of good people in the sector who can help you with that. IPC fund, yes, you're already an expert in claiming IPC fund, but keep the paperwork ready all the time. So you want to prove that you have used it for the right purpose. Cash flow is very important. Yes, if you're using a digital solution, look after the cash flow, see where your cash position is, and your working capital is. Recession, yes, we are officially into a recession at the moment. So the good thing is that social care sector is not really affected apart from COVID. If you can take care of COVID, I don't think there will be a business problem. But many sectors are losing their jobs, and it takes a lot of time in order to improve. Occupancy, the occupancy rates were less during the end of the last wave, and it started picking up, especially during in nursing homes. It picked up very well, based on your areas as well. But I am assuming that as the cases rise up, and if there are more care home bad stories about coronavirus, it is unlikely that people will be willing to come to a care home anymore. Not anymore. It will change over the period of time, but be ready to see a low occupancy for next couple of months, especially Jan, Feb, March. So you may want to have your own strategies on how you survive during that time. And And as I mentioned before, every inquiry that is coming into your care home is very, very important, and it's gold dust. You really need to know how to close that deal so that you get that resident come and stay with you. You know, the less money you have, you will be struggling. So it's better to have more residents, more staff, and you have enough money to carry on your business in a very strict, in a very good way. I think I'm also doing a session next week with some business experts, especially for care home business. I will send you the details out. We'll have a banking specialist, we'll have an insurance specialist, and an accountancy firm who is discussing few items. So if you are a care home owner or a director, or a manager who is interested in business management, please come and join. I will send you the link next week. Not next week, I'll send you the link properly during the weekend. No rest for me. So I think leadership and staff well-being, most of the care homes, they have gone through this once. They had a difficult time during this time. And if you look at Facebook groups for care home managers, the amount of stress that they are going through, it's very pathetic. I think this is a time we all have to remember that you have no care home without people. I think the people are our biggest assets, in even though not in terms of accountancy perspective, but people are our assets. I think they are the people who is going to protect our residents and staff. I think mainly take some tangible step on your leadership. So I think leading a care home during a crisis and during a normal time is totally a different skill set. You have to really rise up and say, we are going to do this. We are going to get to the end of this without any of my staff or resident getting affected with COVID. That kind of inspiration has to come from anyone within your business in order to get through this. So it's very important. And most of the care homes are really good, but leadership is a big factor. If we don't get that right well before the winter next time, this time, your care home business is going to affect. So be very careful who is actually leading your care home. If your manager doesn't have that ability, step in as a director and take over it. Next few months are not for faint-hearted. If you got the idea of how to do this in the last wave, you should be ready. But it's definitely not going to be for the faint-hearted. You're going to go through different challenges depending on what context you're working. But it's very important that you get ready for it. And preparing yourself and the team is very important. I think preparing yourself in terms means how you if you're getting some good rest, if you're looking after your own health, eating and drinking well. It's not about working hard. It's also about taking breaks in between, getting your mental well-being. I think as a jury has actually sent me some info about meditation for care home managers. What a fantastic thing. I think that's a sort of well-being things that we need. When I was a manager, I wouldn't say that, what made me I was a good manager. I think I should ask my staff. But the big thing is, I was able to perform well because I was looking after myself in terms of what I eat, what I read, or what I think, who I hang out with. It's all very important. That's something that we are missing in our sector. I think Jonathan Cunningham in his Facebook group, care home managers inner circle, I think that's what he focuses on quite a lot. He does it amazingly well. How we need to take care of our own people in order to for them to do a better job. Then hold a meeting and explain to them that the real COVID wave might be the second one. So you really need them and bring them together to get to the other end safely. Your mission will be to, no one to die of COVID in your care home. By looking after your staff, in turn, that will reflect on the care they provide. Let the power of your team quadruple for the next few months. You really need to bring it out, get some team engagement activities, put some, giving them gift, everything is fine. It's more about motivation. When you're having a bad time, when there's not enough staff to cover, it's easy for you to sit back negatively and say, oh, it's all going bad. But it's more about, as a leader, bring the morale up, let's get this done. Have a wonderful Christmas together and nobody die of COVID. So that's a kind of motivation that you to bring your team up. So I hope you found this useful. I have got an offer for you. So did you find this useful so far? Isaac really is amazing. He did an audit for us, and really, this is true, Isaac. I do meditation. But yeah, fantastic. Very useful. Thanks. Okay, fantastic. So don't go yet. I think I have got an offer. Okay. So what am I good at? I am good at inspecting care homes. I am good at reviewing all these things, researches. I'm good at business skills. I'm good at telling people what needs to be done in order to survive in this pandemic. I love crisis. You know, when you're a crisis, you actually evolve yourself as a leader to the next level. So I have something in offer for you. So I can do the same stuff. I mean, I used to do this when I was during the first COVID. So I will do fortnightly Zoom calls. So I will look out for all the CQC, Department of Health guidelines, HSC guidelines, NICE, whatever is coming out. I will take care of that. I will go through, sit and study, and then send you an action plan in order for you to cover that. So as managers, as care homeowners, I know very well that you don't have time to read all these documents. Even if you're doing it, you're thinking, oh my goodness, I have to go through this. Leave that with me, and I will do 2 Zoom calls. I'll go through all this documents and send you an action plan saying, okay, this guideline came out this month, and this is what you should be doing. So if you're really interested, then I can offer that for 199 per month per care home. And I can tell you, I mean, I take it from a different angle. So I look at a people perspective, I look at care home business perspective, and I also look at a compliance perspective, not for employment perspective. So that's not something that I'm comfortable to do with. So if you're interested, I can send you some details. The second platinum plan is I can do 2 weekly Zoom calls covering all the updates along with other group. And I can also give you email support. So if you're stuck, you call me or you send me an email. I will come back with your reply. And also, I can also do monthly virtual management meeting with your senior team. So setting up the action plan and reviewing it. So you will have somebody like me to set directions for your team. So that's $799 per month. I think that involves quite a lot of effort on my side and your side. So if I am instructing you to do something, you must do it. And that's the only way to go forward. You must be good by yourself, but having an external opinion will really help your care home to move forward. The third one is Gold Planner, which is limited place. You know, I don't have time to go everywhere, but which includes all this support for the last 2 packages. Along with this, I will also do a monthly on-site visit as well, and then I will be available 24/7 to support. You can call me at any time. I love to have any challenges. You just call me. I will tell you what you need to be done. So I also do a monthly on-site audit review and setting up the action plan and make sure that next time when I come in, you better do it. You know, in a good way. I know you are going through pressures, but it's all about how we can do it together. So so if you're interested, yes, I will send you follow-up emails. Just if you're interested, only just come along, and then we can travel this journey together to make sure that we get to the other end without any problems. Great offers, Isaac. Thank you. Okay, no problem. So, okay. So shall I go through the questions now, or yeah, there are 7 questions here. So Jabriel, hi Jabriel, thanks for attending. Will you be able to share the PDF to participants at the end of the session? Why not? Yes, I will send it through. Give me some time. I have another meeting after this. I'll do that. Okay, Elena, how are we keeping a care home safe and free from COVID if the discharge teams are putting pressure on the managers to admit people from hospital, even though they have tested positive for COVID? Is this not placing the residents and staff to higher risk of uh, contacting the COVID? So few scenarios here. One, the care home admissions plan clearly says people can be transferred with a positive case. It depends on your agreement with the local NHS. So if you're contracted with them for placing people, then you have the legal liability to accept them. But you may want to charge a premium for admitting positive residents to give them one-to-one attention. So that's one way to look at it. But if you have no tie-up with NHS or CHC or anyone, then you can be completely say, I'm sorry. But always remember, these people are needed for us because local authority needs to place people somewhere. And we also need residents to come to our care home in order for our financial viability. So it's very important. Then the next one, Katie, do you recommend doing staff temperatures? Katie, definitely yes. Every day before they start the shift, or document it. It's very important. Kabdul Qadir, the government say that we need to test residents every 28 days, but we have residents who go out every day. Why do they not get tested just like staff every 7 days? That's a very good point. I don't know what kind of settings you have, Mr. Musil. Yeah, that's a very good point. And you may want to do something about it, and you may want to find out where these people are actually going out every day. I mean, are they actually keeping social distancing, or if they're just going to the park, that should be okay. If they're coming in close contact with a high risk person, you may want to do something with it. So Asar is saying, in mental health care homes, our residents go out every day. So again, you have to be a bit more careful here. Azhar, I think if the age bracket is very high, more than 65, the risk is high as well. So if your case is younger adults between 18 and 65, then why not? I mean, they should have a good life too. But it's all about where actually uh, what risk they come to expose to when they actually visit. Shainu Matthews, it's very useful. Please answer the question I asked. I think I have answered the question now. What's the time now? I asked the question at 12:17. Sandra, hi, are the most areas facilitating homes, communicating, restore to, etc. with GPs and getting support? Yes, I think in residential homes, Restore 2 is a very useful tool to monitor. It gives a structure for us to communicate with health professionals. I would highly recommend learning Restore 2. Yes, most of the areas that I come across, people are using Restore 2, but nursing homes, I'm not sure how valid it is, but it's a useful tool anyway. Binsi, during summer, we had a visit in the garden. What would you suggest as the weather is changing? Visit in closed room with shield between them is advisable. Not in a closed room, plenty of ventilation, very airy area. Uh, Keep the distance as much as possible and have a glass shield or something in between. Uh, yeah. Again, it depends on the type of people coming to visit as well. So if it's a one husband and wife and she doesn't go anywhere, she just want to visit the husband, you may want to have an individual plan saying, okay, she's coming to visit him and she can have more approachable time with him, spend more time with him. Kindly list Restore 2. Hi Parveen, you said kindly list Restore 2. I didn't understand the question. Yeah. If you want me to send a link to Restore 2, yes, I would definitely do that. I think that's all the questions that I have here. Yeah, I think that would be the end of the session. I hope you found it useful. So I will send you the links for all the Zoom goals and my packages, and let's get this done. Nobody should die of COVID. We shouldn't be scared of COVID. We can do something about it. Yeah, together we are a power. And I'm always here to support you. Just send me a message. Thank you very much and have a great afternoon. It's lovely talking to you all. Thank you. Wonderful. Thank you. I'm pleased. Lovely presentation. Thank you, Mark. Nice to see you here. Vicky, thank you. Thanks. Speak soon, Jabriel. Yes, thank you. Very helpful. Thank you for your time. Thank you for all your time. I know you are all busy managers and owners. Jadeen Patel, Isaac, do you have a moment for call? Yes, of course. Yes. I don't know your number. Yeah, if you could drop me, I'll just write my email address over there. So you can drop me an email with your number, then I can call you. That's my email. So if anybody want to get in touch with me, just Amina, Adam, thank you. Very informative. Thank you. Thank you. You all deserve to have a lunch now. You can go now. You don't have to say thank you. Go and enjoy. Have a good weekend anyway. We got a long way to go. Thank you, Steve. Thank you. And I'm so grateful. I say thank you for laying this out so simply. life should be simple, isn't it? It doesn't have to be complicated. Thank you, Anna. And thank you for shopping from us. Can you please show the silver plan page for a pic? Oops, that's gone. Yeah, here it goes. Can you send the link to join next week, please? Yes, of course, Karen. I will send it to you. Thank you very much and bless you all. Have a good weekend. Yeah, I will email you later tonight the presentation slides and everything. Fantastic. Great. Good stuff. Let's stop this share. How do I stop it? Stop recording.